While we cannot be on the Hill at Prairie View today, I am pleased to bring Prairie View to the city of Houston, to City Hall. We always expect transformational projects from the first state-supported college in Texas for African Americans, which was established in 1876. Today, the visionary leadership of the university and the A&M system are announcing a transformational effort to benefit Houston's complete communities and other under-resourced and underserved neighborhoods in our city. And that is why Councilmember Carolyn Evans-Shabazz has just come in to join us, because she represents the transformation. When I launched Complete Communities in 2017, which is headed by Shannon Buggs, I promised to not be a mayor of two cities, one of haves and one of have-nots. Every Houstonian has a right to make the choice to live in the neighborhood where he or she grew up and have the same amenities in their communities that are commonplace in so many other neighborhoods in our city. I began in 5 neighborhoods: Acres Home, we affectionately refer to as the Fofo, Gufton, near Northside, and I know it's 4-4. No, since everybody is looking and listening, I know it's 4-4. But in Acres Home, we say Fofo. The Gufton area near Northside, 2nd Ward and 3rd Ward. And in 2019, I expanded the initiative to 5 additional neighborhoods: Alief, Westwood, Fort Bend, Houston, Cashmere Gardens, Magnolia Park, Manchester, and Sunnyside. These 10 communities were selected because they have not reached their full potential due to historical, private, and public underinvestment. However, these communities also have great strengths, opportunities, and partners working to improve these communities, including PrairieViewA&M University and the Texas A&M University system, who are today announcing the PrairieViewA&M University Healthy Houston Initiative. The mission of the Healthy Houston Initiative, Prairie View, is to improve health, nutrition, and wellness in selected underserved communities in Houston. And I might add, it is quite timely. This year, the PrairieViewA&M Healthy Houston Initiative will focus on the complete communities of 3rd Ward, the Prairie, Sunnyside, Cashmere Gardens, and the Acres Home, as well as the neighborhoods of 5th Ward, the Nickel, and Denver Harbor, and the specific communities of the CUNY Homes and Haverstock. And if I might add, by investing in these communities, we're investing in people, we're investing in families, and we're investing in children. It does make a difference, because the uniqueness of today, coming from the Texas A&M system, Prairie View, is that Dr. Simmons is an example that when you do invest, you can come from these communities, be the head of Brown University, now the president of Prairie View, and be right here today. And so I cannot underscore the importance of the contribution that the system as well as the university is making. It aligns with PrairieViewA&M University's mission to invest in programs and services that address issues and challenges affecting Texas' diverse ethnic and social economic population, and the Complete Communities mission to ensure that all neighborhoods have access to consistent quality services and amenities that improve their lives. Virtual and face-to-face activities will consist of nutrition education, food demonstrations, gardening, mental health first aid training, and telehealth screening to assist in identifying intervention strategies for self-care related to diabetes, blood pressure, and other health conditions cited in Complete Communities data books, and action plans. And as we know, this pandemic has had a profound impact on people with underlying communities, specifically in the communities and neighborhoods that we are talking about today. The objective of the Healthy Houston Initiative is to promote healthy lifestyles among underserved individuals and families through outreach, assessment, and non-formal educational programs. And it will expand their awareness of available healthy living programs and healthy services available to residents. And lastly, participants will understand the impact of food and other factors on their health, and learn strategies to prevent and control disease and enhance their family resource management. And let me close by simply saying this. If we can provide people with healthy foods and education and awareness, then we certainly can put them in a better position where they can grow up and learn and be like the people that are on this stage today. And I want to thank Texas A&M System, PrairieViewA&M University for taking the initiative and partnering with us here at the city and the county in building a collaboration that will benefit so many. Chancellor Sharp, thank you. I mean, you have consistently been on the front end on so many things. And then your leadership from the state government itself, and then taking over and being the chancellor of the A&M system has just proven to be impactful. So let me thank you personally, and as the mayor of the city of Houston, I appreciate you. To Dr. Simmons, President, let me thank you, because this is huge. And so I want to thank PrairieView&M University with the full support of the system for what you're doing here today. And I can't say thank you enough. And one of the major reasons why I want to say thank you is because when you're trying to convince people of the need to invest in complete communities, you need people who are willing to step out and say, we're willing to invest. So what the system and what PrairieView&M is doing today, I think will cause others to do more than what they might have done. So what you're doing, I think, will exponentially create investments from so many others. So for that, I want to say thank you. For the entire PrairieView family, thank you.